The floor is yours.
Thank you. I was slightly worried about being unseen because I'm quite short, so I'm having to sit quite far forward. Chancellor, the Pontifical Academy of Social Sciences, Professor Archer, colleagues. Thank you for extending an invite to me to join you for this plenary on human trafficking. It has definitely been an amazing experience, and I'm encouraged by what I have heard from colleagues from around the world, the Academy, the Pope, in relation to this topic. It is an honor to be here. Thank you. I must admit to feeling a little bit of a fraud. I'm not 100% an academic or 100% frontline practitioner, but a little bit of both. I am the managing director of the non-governmental organisation Unseen, based in the southwest of England. As you heard, I co-founded the organisation 8 years ago, initially to fill the void of there not being enough shelters and safe houses for victims of trafficking. We have certainly grown and expanded from our original vision, and having opened our first safe house over 5 years ago, have worked with over 100 women. We have also developed a resettlement program for those settling in the UK, an outreach program for those requiring crisis assistance but not accommodation, and these last two programs work with both men and women, and you can read more about them in the paper that I produced. At Unseen, we endeavour to combine a micro and macro approach so that we both support exploited people and also tackle the systemic issues of slavery. The expert and insight that we gain in each area help us perform effectively across every area of our work. We focus on three main areas as we work towards a world without slavery. We support survivors and potential victims by providing access to a range of specialist services, enabling them to recover and develop resilient, independent lives. We equip stakeholders by providing training, advice, and resources to facilitate the identification and support of potential victims. And finally, we influence systemic change by using our experience and research to impact, inspire, transformation across legislation, policy, and society. I also fundamentally believe and agree with a comment that was made on the first day that we arrived. It spoke of NGOs that unfortunately feed themselves, and I do not wish to sound defensive or justify this behaviour, which I have certainly seen within my own sector, but I do want to offer reassurance that Unseen's main aim is to work towards a world without slavery. And in order to be truly successful in this, we have to be prepared to do ourselves out of business. Having heard Jeffrey Sachs speak earlier in this conference, he said we would have 15 years under the Sustainable Development Goals to get the job done in terms of abolition of slavery. I was planning on giving myself until retirement, so it appears that my timeline has shrunk by at least 50%. I've been asked today to present on the facilitation of a new life for victims of trafficking in the UK. I have to be careful as I present, not only because I talk incredibly quickly, but also because I don't want to just present the difficulties. However, I think it's fair to say that there are many difficulties in resettling a victim of trafficking in the UK. To negotiate and navigate all the processes as a victim is really, really tricky. My plan is to draw upon my experience of frontline work with government, police, and survivors to discuss this topic with you today. And I would also, at the end, like to take this opportunity to take advantage of the influence and the power in this room and make some suggestions, some recommendations for us to think about, to pull apart, and to discuss. As was said earlier this week, if we are to truly address and tackle the issue of modern slavery and human trafficking, we must not just get it right in one nation, as all this will do is increase the risk of displacing the issues to other areas. We must, however, start somewhere. Unseen views resettlement and reintegration to mean the point at which a person is economically and socially capable and independent, no longer at threat or risk of being re-trafficked, and most importantly, no longer requiring the services and the support that we as an organisation offer. This is one of the fundamental tenets of the resettlement service. It is in place to empower and to promote independence and resilience, not to create an over-reliance on our service and our workers. Support focuses on both the practical and emotional needs that survivors have in order to continue their recovery and to assist them becoming independent members of society. Facilitation of a new, productive, and fully integrated life for an identified victim of trafficking in the UK is unfortunately fraught with difficulties. Residing and staying in the UK is not something every victim of trafficking will be able to do. And being identified as a victim does not equate to long-term support within a UK context. Once a decision has been reached, formally identifying an individual as a victim, there is no automatic entitlement in terms of residency, temporary or otherwise. The ability to reside, to remain, and to access services is based purely on immigration status. The widely accepted notion within the sector that victim protection and victim assistance should be unconditional and not dependent on the capacity or willingness of the victim to cooperate with law enforcement is currently not enacted in the UK. Whilst rhetoric from official channels and government agencies is one of separation of the issues of immigration and trafficking, time and time again we see the two issues are inextricably linked. We have, for example, recently seen an increase in the trend of Home Office asylum interviews being used to determine trafficking status. We have seen the decisions around trafficking, which are currently created from a frontline professional filling in a form and entering it into the UK Human Trafficking Centre. That process is all done via paper. A decision on trafficking is created from a piece of paper and subsequent information that's forwarded. An asylum interview, however, is done via interview. We have seen time and time again that the trafficking decision waits upon the asylum decision. They are meant to be two processes that run completely separately, and yet time and time again, victims of trafficking are left in limbo waiting for one or other decision. This, in my opinion, and many opinions of frontline professionals, is highly inappropriate. The asylum system, and whilst I'm not here to talk about that today, basically approaches guilty until proven innocent. That's the approach, which is really not appropriate for a potentially highly traumatized individual and victim of trafficking. There is no official government-led programme or long-term support mechanism in place in the UK. The system in place for initial care does not afford people any long-term support. Under the UK's provision, you are allowed 50 days of reflection and recovery once you have been identified as a victim. The creation of a resilient, empowered, and contributing member of society is currently not a government priority for this population group. The approach and stance favoured and presently taken by government is one of repatriation and return. Whilst we agree that options to return home should be explored and they need to remain a valid option, we also need to further understand the issues related to repatriation to fully understand what it is we're returning an individual to. If the situation that initially led that individual into being trafficked has not altered, returning them increases their vulnerability of being re-trafficked if appropriate support is not in place. We are not in a position to dictate appropriate support in other countries and jurisdictions. However, we would express concerns that not all countries to which individuals are returned will have the same human rights record or approach to victims, or the support mechanisms in place that they are required to assist them. We want to work with partners, statutory, non-governmental, and the private sector to create and promote a system whereby people are able to be economically viable, self-sufficient, and self-contained post-trafficking episode. This will take time to achieve and has to be done in partnership. It is vital that wherever possible, survivors understand the mechanisms that they are part of and are given the information that allows them to make informed decisions whilst facing the realisation that the decision to stay in the UK is often not one they can make themselves. It will be dictated by the authorities and, unfortunately, based upon their nationality. Any resettlement programme offered should not be run by one organisation in isolation, and needs to support a survivor to integrate with services, support, and friendship groups that will continue far beyond the trafficking elements of a survivor's case have been concluded. This cannot be about NGOs empire building or creating a role for themselves, but about finding sustainable and appropriate solutions and responses for all survivors that involve a range of agencies and organizations. Caring and supporting identified victims should be the responsibility of government, civil society, individuals, and organizations. But the ad hoc nature of the systems we currently have in the UK is not sustainable, nor is it providing the best for some of the most vulnerable in our society. I would like to spend some time now looking at the issues we as an organisation have faced during our direct work with survivors. I often find myself between a rock and a hard place. I am a member of an anti-trafficking task force in the Southwest, and part of our remit is to gather intelligence about the nature and scale of trafficking and slavery in our area. The other part of our remit is to conduct welfare visits into areas where we think that victims of trafficking may be held. Proactively, we go into these areas and we let potential victims know what their rights are, what their entitlements are, and offer them an opportunity to leave with us should they wish to. I say that last bit carefully. We have to be incredibly aware that when we go into these places, whatever we might think personally, this is a person's place of work. Just because I have walked in as an NGO with my law enforcement counterparts and other agencies does not mean that might be a right time for that person to leave with us there and then. We have to really rid ourselves of this victim mentality and the fact that we are there to rescue. What we do is leave information so that actually at a time when they do want to come forward, a time that is appropriate for them to leave, a time when maybe they've called their family at home to check that they too are safe before the individual makes a decision to leave, is what we are kind of advocating. So, as part of this multi-agency task force, over the last 4 years, I think I have interacted with probably around 300 people. I have been into nail bars, into brothels, advertised and otherwise, so private residences. I've also been into car washes. So nail bars, brothels and car washes are 3 areas that in the UK we are very aware that are potentially holding victims of trafficking. Now, what I will say is that out of those 300 people, I think probably, I would say 1/3 of them have shown indicators of trafficking. The rest of them, as I call it, have been probably on an exploitative spectrum. They would not be identified as victims of trafficking under UK legislation, and yet there has definitely been elements of exploitation that have ended them up working where they are. Out of these 100 people, 2 have opted to leave their situations with us. 1 has come forward at a later date. And this is what I mean between a rock and a hard place. It is right that we go in there. It is right that we proactively look for the people. It is right that we let people know about their entitlements. And actually that in the UK, there are things like minimum wage, and they should be entitled to housing, and they should be entitled to all these things. So there's an educative process that happens. But even though we have been doing this for 4 years in partnership with law enforcement, we still have only had 3 people come forward. The question I'm often left with post such operations is if someone does want to leave, can I refer them into the UK system? I am a first responder under the UK system, which means I have a legal obligation to do so. But how can I enter them into a system knowing that 50 days later, their options are potentially even more limited than they were when I first encountered them? This is where I have to be a pragmatist with my work and say that 50 days with no slavery is better than no days with slavery. However, if the prospects offered post 50 days are worse or comparable to the original exploitative situation, what is the incentive for them to leave? If what we're offering, in effect, is no promise of long-term sustainable income, no promise of their ability to enter the job market, no long-term accommodation, add into the fact that they now are known by the authorities and there are potential immigration issues. All we have done potentially with that multi-agency visit is put these people on the radar and actually not offer them anything that is sustainable. Even in their trafficking situation, they might be being paid. They might not be being paid the right amount, but there might be some money exchanging hands. They often will have accommodation. They often will have food. They often will be with people from similar communities speaking the same language as them. What I'm offering them is moving into a safe house where hopefully someone will speak the same language as them. They might not have any option for that long-term sustainable job market that's what they came to the UK for. I believe there is overall currently a lack of assistance and incentives for someone to choose to leave their situation. And this directly impacts the ability for those enslaved to even come forward in the first place. This is not to say that the system doesn't work at all, and I am very, very aware that compared to a lot of countries represented here, the UK does have systems in place to support, and the government is engaging with a range of partners and organisations to discuss how we assist those identified better. For this, they do deserve recognition, but as always, there is more to be done. Last week, I was called to our local hospital to consult on a case. A nurse had concerns about a patient that she had been working with, and he had been visiting the hospital regularly for the last few months as part of his treatment plan. His trafficker let him go out every couple of days to the hospital, and he was okay with that because the hospital wrote an official letter and said that the patient had to be there at that time, and the trafficker allowed that to happen. Indicators of trafficking became more and more apparent, and the nurse was concerned. So I was called in to assist him. We managed to have some really serious and frank discussions about his options, about that actually he could go somewhere safe for 50 days, but after that time he might have to find work, that he might even have to return home, and what we could do to support him with that process. Because of the regular appointments at the hospital, he decided to return back to his situation of exploitation whilst he thought about his options. As I landed in Rome on Thursday, I had a text message from the nurse. He had decided that he would leave his exploitative situation and was on his way to safe accommodation. Aware of his options, knowing he had had enough of being exploited, and being in a place where he wanted better for himself, he had made a truly informed decision, knowing all the potential outcomes. This case was built on relationship and trust, and about over 4 months of work that was built up with his health team. We can't predict the outcome for him, but at least he is aware of all the potential options. And often, interactions that I have with potential victims of trafficking happen over such a small time frame. You don't get that opportunity to truly explain all the pros and cons of someone entering such a system. An overriding issue we face in the UK to effective provision of resettlement is the benefit system itself. To claim benefits in the UK takes on average 77 days. This time frame has some caveats. It assumes that your trafficker hasn't claimed benefits on your behalf previously, which is a trend that we are seeing more and more. So assuming you have no previous claims, and assuming that the system works in a timely manner, you should be granted a national insurance number. A national insurance number is a key, if you like, to access the job market and to benefits. As I mentioned earlier, under the UK's provision, victims of trafficking get 50 days. As you will see, there's a shortfall here of 27 days. 77 days to apply for your national insurance number, and 50 days in a safe place. In the worst cases, this leaves individuals who have been positively identified as victims with no income and no accommodation for a minimum of 3 weeks. Even as a European national, choosing to exercise your treaty rights in the UK, you cannot access housing benefit. This has resulted in street homelessness in some situations. And here as an NGO, we need to strike the balance of showing that the systems don't work and directly challenging the legislation and policy that creates the loopholes so that government are aware of the issue and have evidence they can use to make the necessary changes, whilst not intentionally putting the victims at unnecessary risk. And this has caused us having to accommodate people for longer than we should do. Recent benefits changes in the UK has also provided further challenges for Unseen and the people we work alongside. As EEA nationals, you are now only eligible to claim benefits for 3 months, after which you have to have secured a job. Another caveat to that, which is hugely problematic, is that if you have no evidence of having been self-sufficient and working in the UK prior to claiming benefits, and this has obvious implications for a victim of trafficking. As a non-EA national, your legal team might advise you to take the asylum route. This, while providing accommodation and reducing the issues of homelessness, does not solve all the issues. An individual still faces financial issues, no direct face-to-face support, and no ability to access the job market during the time they're in the asylum process. People who came originally to seek better or alternative employment opportunities are left waiting sometimes for indeterminate amounts of time for their status to be determined, even though they've already been predetermined to be a victim of trafficking. Another challenge my team faces, we have 2 Western African women living with us at the moment, and for me they defied all stereotypes. I don't often get to go to visit the safe house anymore, but I love it when I do, and it's a reminder of why I'm doing what I do. And I met with these 2 women last time I was there. One is a trained accountant, and the other has a degree in mathematics. Both were awaiting a determination as to their trafficking status, but neither of them are EU nationals. They have few, if any, options to remain in the UK. Even if they are determined to be victims of trafficking, there will be no result, this will not result in leave or the right to remain. 2 intelligent women who want to work, pay tax, contribute, be self-sufficient, and with their qualifications could easily do this in the UK, and yet may not be offered this because of their nationality. The above issues can be solved, for sure. It requires agreement of various government agencies, but it is doable. As I discuss in my paper, automatic discretionary leave upon a trafficking determination is a way to maintain support for victims. Currently, discretionary leave is granted if police are investigating the case and if the victim is cooperating. To date, this has been a system that has been underused. The development and creation of a pathway to passport program, as Professor Archer put forward in her recommendations to Pope Francis, is an idea we would fundamentally support. It is our belief that once a positive, conclusive grounds decision is given, it should result in some form of status. Leave with benefits, the access to appropriate support, the job market, and accommodation. Leave should be automatically activated and should occur regardless of the individual's immigration status. We currently have a system that affords different victims different access to different support mechanisms based on nationality. I do, however, need to be clear that granting leave in isolation will not solve the issue. Assistance and support of varying levels will be required and should be offered. As was mentioned by Mr. Vera on the first day, we have to be careful with the assumption and notion that a person potentially traumatized by their experience will immediately be self-sufficient. Some form of assistance and support will be required, and any program must account for this. I appreciate I have focused a lot on the difficulties, but I think that they highlight the need to enter productive discourse with governments and the policymakers to ensure and encourage that there is joined up effective thinking across all the different departments so that those identified as trafficked persons are not slipping through the gaps. Let me conclude this section with a story of success, so I leave you with some hope and let you know that it's not all bad. Trafficked into the UK at the age of 14 by a family member, forced into domestic servitude. We worked with this woman when she had turned 19. She speaks good English, but had missed a lot of her secondary education due to her exploitative situation. After an initial stay with Unseen, she applied for asylum, and we continued to support her while she was in asylum accommodation. Her decision was delayed for over 9 months, but during this time, she was supported to access free education, to seek voluntary placements. When she was granted leave last year, it was a time of much celebration and the result of a lot of hard work by our support workers and her legal team. She has subsequently been supported to move into an independent flat. She is attending school, has completed a work placement, and started work. 3 weeks ago, and this is the real celebration for me personally, Unseen said goodbye to this amazing young woman, as she now feels that she is ready to go at life on her own. This is an amazing achievement for her, and the resilience and determination that she showed absolutely humbles me. I would now like to move on, possibly cheekily, to some considerations and recommendations. To fully understand the successes and difficulties of facilitating a new life in the UK, further research is needed. It is a really under-researched area. The systems that survivors have to interact with need to be fully understood. Survivors and support workers need to be consulted. We need to understand the direct experiences of accessing services and the barriers that victims face. This would then provide a comprehensive basis to start the discussions around the development of such a pathway to passport program. Any support package that is considered has to pay due attention to the individual experience of the survivor. Duration of trafficking experience, type of support an individual needs. We have to accept there is no predictable time frame. Recovery means that individuals will take positive step forward and then a few step backwards. We can't time frame that. We can't guess how long that might take one individual to compare to another. And we need to ensure that when these setbacks occur, the individuals have coping mechanisms, strategies, and their own internal resilience to be able to deal with them. Unseen advocates for the creation and development of a specific resettlement program. We believe that once a determination is given, individuals should automatically be afforded some form of permit. Ideally, this permit should not be related to immigration status or to cooperating with law enforcement, but about their trafficking experience. Building on the current system in the UK of discretionary leave would be a good starting point, and as long as leave is granted to individuals, regardless of the interaction with law enforcement, will give the continued support that we have to give under the European Convention, including at minimum access to appropriate housing, identification documents, professional support, the job market, vocational training, social inclusion activities, learning English, education, healthcare, legal advice, and compensation. I've just realised that's a long list. It should at minimum include all those things. I fundamentally believe that the initial upfront cost of such a suggestion will more than be recouped by these people successfully reintegrating into life in the UK. I'm no economist, but I do think it would save money by front-loading all those services and assisting people to become resilient, independent, contributing members of society in the future. Identifying how other agencies, faith communities, and individuals can be involved is also an area that requires further thought. Practically, can the Catholic Church have a coordinated approach, not only in the UK, but further afield? Can we provide job opportunities, internships, and voluntary positions, and other meaningful activity for trafficked persons via programs that are already established and running? Is it a case of expanding remits and identifying potential opportunities that already exist within church communities and expanding them to include trafficked persons? Can programs that offer a more familial-based living, allowing integration through society via community, be provided by the church? As Mr. Hyland said last week, via Bakita project, they're investigating host families to provide longer-term accommodation. Could this be a program that goes further than one church, in one city, in one country, and a way that practically the church can support those who have found themselves trafficked and enslaved? This could provide an effective resettlement and reintegration option, either in country where they have been identified or if returned to their country of origin. Adult fostering programs via voluntary groups and faith communities is something that has worked well for the elderly, young people, homeless, refugees, and those with learning difficulties. Would embarking on a similar program for victims of trafficking offer this improved long-term resilience? There are numerous challenges that we have seen the survivors that we support face, even once they are granted leave to remain. These issues and challenges need to be fully understood so that we can identify the resources and support needed to assist recovery. We need to address our civil, legal, societal, and moral duty to vulnerable people, and to try and create an appropriate response and mechanism that fits the UK's way of doing things. By working with people, moving them towards resilience, we will be assisting survivors to fulfill their desires of economic improvement, which usually will have been a factor and driving force behind their reasons of coming to the UK initially. We must continue to strive for safety, hope, and choice for all survivors, and take a thorough look at how we allow for and actively encourage resilience and empowerment. We are under no illusion that is right and proper. to care and work for the people that are currently within the systems, identified as victims and needing an agency to advocate on their behalf for the most basics of rights. But we also have to admit that this is a sticking plaster. The damage has been done, and we are coming to help too late. It is currently necessary and right to offer these services, but we must get to a stage whereby entrapment and enslaving of our fellow human beings is no longer an issue our society faces, a massive aim, but we each have to do our part as we work towards a world without slavery. We have big ambitions, big plans and dreams, but if we are to tackle slavery, we have to think big. We have to think outside of the box. The potential, the power, the influence of researchers, practitioners, the church, PAS, and other determined individuals in this room I believe, have a significant impact in this area and result in practical action to directly benefit survivors and hopefully put an end to slavery. Thank you.